Hi, everyone. Dr. Paul here from the East Ontario Health Unit with my weekly update. Today is June 22nd, 2022. I'm going to start as usual. I'm going to share my screen and go over some of our local data. We've had low hospitalizations. Actually, last week we had a couple of days of no hospitalizations, which is good news. Now we're up to two hospitalizations. And if you look at sort of the trends of hospitalizations again, I said we had a couple of days of no hospitalizations for COVID. Right now, we've got two and none in the ICU. If we look at our percent positivity, that too is on its way down. Very clearly going down. Right now, we're about 3.9%. And again, very clear downward trend of that. The only thing that's gone up in our area are the outbreaks, and we've seen that provincially as well. We are up to 7 outbreaks right now, but for a very small number of cases. You could see here, this one staff case, and then 45 residents is one of them. That's a long-standing one. But for the most part, we're among those. We've had many more cases in outbreaks before. So again, this is something that we're monitoring and keep an eye on. But again, you could see sort of the downward trend, a bit of an upward trend here, and we're going to see that. We're going to be getting. I just want to tell everybody that we will be getting ups and downs in some number of cases and those type of things. But over a longer term, I think it's just going to be little waves up and down, throughout the next couple of weeks, certainly July into August, and then we'll see what happens in the fall. But that's what we're going to be expecting. Our other measures in our area as well are showing that, again, if you could look at our wastewater, we're flat here. This is the Hawkesbury one, and we also have the Cornwall one as well, which is flat. The Castle one, we've had some technical difficulties, so for now we're just going to be using these two as our monitoring. And as I said before, we're adding Morrisburg shortly to the wastewater testing. And so that is something that from our point of view is going to stable, and I think it's going to downward trend. And so the other thing that we're working with right now is vaccinations. And again, we're now up to at this point we're almost 58% of the population 12 plus has had a third dose. If you look at 18 plus, it works out about 61%, and our fourth dose is about 35% total of the eligible 60 plus. And again, you could see that slowly we're increasing, but still we need to get up as much as possible for all 3 and 4th doses for people that are eligible. In terms of some of the provincial data, again, what we are seeing really provincially is a similar trend. In fact, I'm just going to share with you the most recent scorecard that we've had in the province. And again, just like we've seen last week, we have a decrease in practically every other sort of indicator, except for what we're seeing is outbreaks. I just want to go back to unfortunately, we added 1 death last week to our numbers. Tragically, again, it was a 70-plus-year-old individual with underlying medical conditions. And so that is a tragic the tragedy. See, we still have deaths, so we're not out of the pandemic, although they are going down. But again, they're lower, but again, they are happening. And again, it's just a reminder that it's still potentially around us, and particularly can affect the vulnerable individuals. So so having said that, I just want to go back here and like I said, we're overall the deaths provincially and in our area have decreased. I mean, this is the rates have decreased tremendously. I was at a meeting last week where we have among the lowest case fatality, in other words, death rate per cases in Canada right now. So that's good. And that means that the vaccines are working, because the role of the vaccines is to prevent severe disease and death and hospitalization. And then if we're looking at other measures, for example, health unit numbers across the province, you could see here We're now down to 15 cases per 100,000, and this was up in the hundreds a couple of months ago. Last week it was, I think, 18.9. So we are on a downward trend here as well. If we're looking at positivity across the province, that is also going down, stabilizing here a bit. Ups, there'll be the ups and downs, but overall, they're much decreased as compared to previous times. If we're looking at health units that are experiencing decreases, you can see that most of the health units are going down in terms of numbers. And you could see that, again, some of the very small increases are actually stable here. So again, for the most part, either most health units are stable or going down week by week basis. In terms of the actual wastewater signal provincially, we have seen a bit of an uptick provincially. We could see a bit of a leveling off here, up and sort of leveling off here, east as well, kind of uptick, but leveling off. But overall, with the exception of Central West, it's going up a bit, but leveling off here. Overall, we're seeing sort of a small increase to flattening, and that's something that we're going to keep an eye on. And again, what we're doing is we're looking at not only these values, but we're looking at hospitalizations and other measures, positivity and so on, which are actually going down week per week across most of Ontario. And again, just to remind everybody, the rates of death, hospitalization, and ICU admission are higher among individuals who are not vaccinated, and so I think that is kind of the wrap up of this week. We're going on a downward trend. Again, we're looking at a bit of an increase in certain areas. It's not matched by increase in hospitalizations or ICU admissions. I do expect that will be going up and down at a low level, not a zero level, but a low level of transmission. And it's still quite important for everybody to go and get their third or fourth dose. Continue to wash your hands, continue to stay home if you're sick. And importantly, like I said, wear a mask where you're indoor, crowded, poorly ventilated areas, particularly if you're uncomfortable or if you yourself are vulnerable or with vulnerable individuals, or if you don't know the vaccine status. But for the most part, like I said, over the summer, I do foresee lower cases, and I do foresee that the summer will be more normal than it was in the previous years. We are preparing for the fall. We have heard, as you know, in the United States, for example, there is the recommendation now, not recommendation, it's actually been approved that for children 6 months to 5 years of age can receive either Pfizer or Moderna COVID vaccination, and that's already started in the United States. We're already making plans because we're waiting for approval of the Moderna vaccine here in Canada, which likely will happen over the next couple of weeks. So that's something that we're looking at. And we're also preparing for the fall. There likely will be other boosters or new boosters with perhaps Omicron in it. We're keeping an eye on variants. So far, so good. We have the B4 and B5 Omicron variants that are a bit more transmissible. They are starting to increase. We're keeping an eye on that as well. We're keeping an eye on wastewater positivity. And again, we're preparing for perhaps a surge, not only with COVID in the fall, but also with influenza. But for now, right now, we're just in a mode of observing and observing these little waves up and down, nothing significant, I don't think. But we are still keeping an eye on it and being mindful that we're still in a worldwide pandemic, although we're doing better in our area. So thank you once again, and I'll talk to you next week.